Hello. Thank you so much for coming. I'm Troy Stutz with RJM Construction, but also the president of AMFP Upper Midwest. Again, thank you so much for coming out and to this program. We really appreciate it. Hello. Thank you so much for coming. I'm Troy Stutz with RJM Construction, but also the president of AMFP Upper Midwest. Again, thank you so much for coming out and to this program. We really appreciate it. A couple logistical things. Restrooms, if you haven't found them, are through those doors to the left and then to the right. You'll find the restrooms there. There's also after the program, please stay around. We have some cheese and crackers, an adult beverage, possibly wine or beer. So you're more than welcome to stick around and network a little bit more after the program is completed. With that, again, thank you so much. We appreciate it. I'm going to turn it over to Stephanie to introduce the program.
Hi, everybody. I'm Stephanie Stutz with RSP Architects, but I'm vice president of AMFP. Thank you for coming to Green is the New Black, how and why healthcare organizations are choosing for sustainability and the environment. Our three speakers on the chairs, I think it's funny. We have proxy speakers right now. Actually, they'll step up there in a little bit, but we've got a really good group today. I don't know if you knew this, but this region where AMFP has some of the greenest healthcare organizations and hospitals in the country. In 2018, I think it was Green Healthcare Practice, of the 68 greenest hospitals, 8 of them were here. So that's pretty big percentage. Today we have 3 speakers. We have Amanda Holloway from Mayo Clinic. She's right there. Dana Slade from Health Partners and Dustin Maddie from Centricare. What's really cool is they all know each other because they're part of Heart Midwest, which is the Healthcare Environmental Awareness and Resource Reduction team. They're all on a committee together. This organization is an organization that connects healthcare professionals to encourage and support sustainable actions that improve environmental and community health and reduce costs. So cool stuff. I'll just introduce the speakers now. If I can find the right thing up here. Okay. There we go. So our first speaker will be Amanda Holloway. She's a Green Associate and the Director of the Office of Sustainability at Mayo Clinic. She's worked with Mayo Clinic for 18 years, and her current sustainability role is guiding enterprise sustainability to advance organizational goals and energy and waste reduction, water conservation, supply chain practices, the built environment, and employee engagement. Our next speaker is Dustin Maddie, who is a lead AP and sustainability program analyst at Centricare Health. And Dustin's role is, I think it's fascinating. They all have kind of different titles and slightly different roles too, which is cool. In his role, he works primarily with the facilities department to reduce energy consumption, resource renewable energy, and increase the efficiency of new construction projects. He also supports other departments throughout Centricare's 8-hospital health system to decrease the environmental footprint of operations. Our third speaker is Dana Slade from Health Partners. Dana did our very first program, so he's kind of got a little special place in our hearts for taking that on that time. Dana is a CHMM, and I didn't know what this is, but now I do. He's a certified hazardous materials manager and director of sustainability programs with Health Partners. So Dana is responsible for managing Health Partners' comprehensive set of sustainable programs. He's also responsible for facilitating the Enterprise Sustainability Steering Committee and is a member and co-leader of the organization's green teams and sustainability working groups. So those are our 3 speakers. Now I'm going to tell you a little bit about the format of what we're doing today, because we're going to do this a little different. Each of the speakers is going to do this Pecha Kucha style, or Pacha-Kacha, depending on how you pronounce it. I'm looking at Eric because we have a debate on that in our office constantly about how it's pronounced. Their presentations will take 6 minutes and 40 seconds precisely. They have 20 slides, and the slides will advance every 20 seconds. So there's no dwelling in one spot. So after each of them does their presentation, while they're doing it, I'd like you just to think about topics and questions that you have. And if you see, you have these nice giant Post-it notes and markers. After everybody's done their presentations, we'll just pause for a few minutes, and then you can write down questions, and we will put them all up here, and Troy will help me organize them, and we'll pick a question to ask the panelists or a topic, and they'll have 4 minutes to talk about it. At the end of 4 minutes, the audience will decide if we want to continue another 40 minutes on the discussion on that. We'll give a thumbs up, and if you don't, we'll do a thumbs down, and we'll go on to another question. So if you were at our last program in April, it was with the Lean Construction Institute, and that's the format we use. So it's really fun because you, the audience, really drive the content after the presentation. So I'm trying to think if there's anything else I'm missing. I think that's it. So Amanda, if you'd like to start, you're in the hot seat. It's a little intimidating. Like, it's kind of fun because some of the slides, they go really fast, and other ones you're like, wow, I didn't know 20 seconds took that long.
Does the slide advancer? Does the slide advancer work? Or?
Yes, but what did I just do? Okay. I go here, and when I start it, you start.
Perfect. All right, here goes this train. This is a great opportunity. So Mayo Clinic's Office of Sustainability is relatively new, but sustainability at Mayo is not. So I'm going to share some information about our sustainability journey, as well as providing some information about current and recent sustainability initiatives. Perfect. Mayo Clinic is one of the largest nonprofit academic medical centers in the United States. We have destination sites in Rochester, Minnesota, Arizona, as well as Florida. And then we have dozens of hospitals and clinics in the Mayo Clinic health system in Wisconsin, Minnesota, and Iowa. So all told, we have 63,000 employees. Our mission statement, our mission is to inspire hope and contribute to health and well-being by providing the best care to every patient through integrated clinical practice, education, and research. We really specialize in treating the complex, serious illness, and we see 1.3 million patients every year, which is a tremendous opportunity. So we are a values-driven organization, as many medical institutions are. Our primary value is the needs of the patient come first, but I also wanted to highlight our value of stewardship. We really highlight and we wisely manage our natural, human, and material resources. Fun fact about Mayo Clinic, our sustainability kind of initiatives go way back to the early 1900s with Dr. Charlie Mayo originally starting the garbage collection service for the city of Rochester. So the garbage was collected and sent to Dr. Mayo's hog farm, and the garbage was used as hog feed. So kind of a neat way to highlight that. Our journey really kind of fast forwards to 2009. We created an environmental statement at Mayo Clinic, and this is where we start to formalize our sustainability programming, and we really kind of recognize the link between public health and environmental health. Our environmental statement goes through, or kind of highlights how we integrate that into our operations. Right about that same time, we started creating green teams or green committees across the organization, starting with our Rochester campus, and then shortly thereafter with campuses around the organization. We also formed the Mayo Clinic Green Advisory Council to really provide that strategic oversight for the organization, and you can see that we had sort of a lead into our leadership. So we had some success with running the system with our committee structure. We had the environmental statement, we have these great green teams, we even had some recognition for the work that we were doing from organizations like Practice Green Health. But we we're still challenged with really infusing sustainability into our organization. Even though we had these bright spots, we were still limited and dispersed, and really had a desire to standardize, formalize, and really integrate sustainability into how we operate at Mayo Clinic. I think it was right about 2016, the organization, we had a new Chief Human Resources Officer join us, Kathy Fraser. She was really passionate and interested in sustainability. She started having conversations with our really top level leaders. And this is about the time that I partnered with Kathy and others on starting to build the business plan for Mayo Clinic to integrate sustainability. Did a lot of research, spent a lot of time putting together the sustainability plan. And in early 2018, we had the opportunity to present that to our CEO as well as top leaders. And they approved it, which was great. But some of the feedback we received was they wanted bolder thinking. They wanted us to engage employees and physicians. And they wanted us to make sure that we were building sustainable buildings. So in 2018, June of 2018, about a year ago, we were off and running. Our goals really were to standardize sustainability, to find those best practices, to create those enterprise standards, to engage employees, and to partner with departments across the organization, like facilities, surgical services, supply chain. And as I said, one of our biggest challenges is that standardization. Even from just a regional perspective, we operate campuses and facilities in very diverse areas, culturally diverse, biologically diverse. So there's some significant challenge with standardizing our practices across the organization. One of the things that we just very recently did was create a sustainable building policy that applies to all of our campuses. It really applies to new construction, large remodel. We also created a checklist that accompanies that policy and pulled from a variety of resources that we have listed that are typically common in the construction industry. Energy is also a significant focus for us. Our Rochester campus really kicked off our energy programs by setting a goal to reduce energy usage by 20% by 2020. That goal was met by the end of 2017. But that campus and that initiative was also really fundamental to creating an energy policy and energy management guidelines. Food services is another really important partner for us, focusing on local and sustainable purchases as well as food reduction. And employees are really pleased because food service just recently announced that they're going to eliminate the use of styrofoam from our cafeterias across the organization. So we got lots of thumbs up from employees. Another significant challenge for us, being a large organization, is just gathering the data, the metrics around sustainability. So we're creating a sustainability dashboard that will initially focus on energy, waste, and water. The dashboard, especially with energy, is kind of neat because we'll be able to see real-time energy usage in some of our buildings. We're also partnering with our supply chain group. They've created an environmentally preferable purchasing policy that applies to all sites. Focusing on purchasing more green materials. Also, single-use surgical device reprocessing is a significant part of some of our supply chain partnerships, and that's what you see here. It's a great way to reduce our waste stream. So our leadership, as I said, had a really significant focus on engaging employees. In 2017, we had the opportunity to include a couple of questions in our all-staff survey. And I don't expect you to read this within 20 seconds, but just note that we have lots of opportunity to improve how employees see the organization as it relates to environmental sustainability. And one of the ways that we're engaging employees is we just recently launched a Green Advocate program. We're recruiting volunteers from across the organization to be that work unit environmental champion and to really make change at the work unit level. We also have opportunities to engage on some internal social media platforms. We're offering eco-challenges. And what's next for Mayo Clinic? We really need to work on our 5-year strategic plan to really create those goals, set goals for the enterprise so that we can track and report our progress, looking at renewable energy as well as our carbon footprint as well. And so that was a really fast 6 minutes and like 35 seconds.
That was awesome. So our next speaker will be Dustin Maddie from Centricare.
Oh, I think it fell off the table. Hold on.
It fell somewhere.
Oh, here we are.
So I think, oops.
Yeah, it's better.
I'm a whiz at all this.
Right. And I believe I have to click through the first one. All right, so hello everyone. As you can see, Dustin Maddie from Centricare. We'll just start this up and see where it goes. If that's working. Actually, the keyboard works, doesn't it? Okay, so Centricare health system. Raise your hand just in the room. Have you heard of Centricare? Okay, you're in the industry, so you know. Okay. I don't usually get that response rate around here. But so Centricare, we're going through a brand changing right now. It used to be Centricare Health System when I started, then it was Centricare Health. Now it's just Centricare, and it's got some nice blue paint marks, and this is our new identity. So right now we're up to a pretty big system. We used to be just a 3-hospital system 7 years ago, and now we're up to 8 hospitals. As you can see, 30 clinics, a bunch of senior centers, pharmacies, a whole array of services. We've kind of grown really quickly, and we're getting to the point where we're trying to standardize everything, maybe act more like a Mayo or Health Partners, which their Mayo or Health Partners is about twice as big as us. Mayo's even bigger than that. So as you can see, we reach all the way up to Brainerd and all the way down to Redwood Falls. We've actually got a hospital under construction in Redwood Falls, but in all these communities, we're kind of the healthcare provider for all of these communities and the the general areas. I'm the sustainability guy for the health system, so I'm a system level employee. I work out of the facilities department, so new construction, maintenance, all operations, that kind of stuff is where I do most of my work. I report to the facilities vice president, which reports up through the CFO and to the CEO, so we all report through different structures of sustainability folks. I forgot what that last bullet point was. But so stewardship is one of our core values, which is kind of one of the reasons I have my job, what I'm doing here at Centricare. So we, like most hospitals, we try to take care of people, but we also try to do no harm. We try to take care of the environment. It fits with our core values as a sustainability focus. So as I said, we are a lot of the times the one care provider in a lot of the communities we're with. So we take very seriously our partnerships with our community partners. Here we got like a wastewater treatment award because we pre-treated our wastewater out of one of our hospitals in St. Cloud, and it was it's a need to just partner with your community, and that we find value in that. And so some of the short-term benefits of paying attention to sustainability, absolutely it's money. Saving money is important. It's a nice thing about sustainability. You do it right, you actually spend less money. Then common stuff, reducing pollutants. It's good for marketing. It helps give more reliable operations, and it's just the right thing to do. Long-term, again, saving money, but pollution, it adds up over time. If you can fix that early on, long-term solutions are much easier to come by. Increasing resilience, transitioning to lower carbon, lower meat. That burger right there is actually all plant-based. That's an Impossible burger that we're serving in a couple of our cafeterias. As far as designing for sustainability, it's typically, you all do this for a living. You just kind of pay more attention to some things, waste generation, how much energy you use. You always want to make sure that the teams you work with are incentivized to save electricity, save waste, and make sure the whole team is at least thinking about kind of the principles of sustainability. When we're actually building projects, we do just the typical waste sorting measures, managing airflow, watch out for chemicals. Who knows what went wrong in this picture here? Do you want to say it? Yep, they used too long a fastener, so it went right through. So we got to pay attention to just simple mistakes like that while we're actually building, because there are long-term consequences for that. We don't like paying the heating bill to melt the snow off the roof. Operating, again, minimizing waste. Pay attention to the energy we use, and this is fun. We're doing some salt pre-treatment. There was a snowstorm about to hit when I took this picture, and so we're doing a liquid pre-treatment on a lot of our parking lot services. Save salts. It's less money, and it's actually safer because fewer people slip if you pre-treat. We're supposed to talk about the triple aim here, but Centricare just goes one step above. We do the quadruple aim, which is the triple aim, but we add the people of Centricare to our intent. So we, the cost of care, community health, patient experience, all of that, but then we try to care about our employees, because without our employees, we really can't do anything. It's a lot of what we do. Then there's the triple bottom line. That's kind of sustainability, people, planet, profit. And if you look on the left side of that chart and you look on the right side of the chart, they're pretty much the same thing. You can argue the triple bottom line and the triple aim are pretty much the same thing, looking at from two different angles. So that's why sustainability fits in with our healthcare desires. So we do a lot of fun projects here. This is we changed some spray heads on our helipad and actually reroute the storm drains into the sanitary sewer when we do our testing. We did this in partnership with utility, the wastewater treatment plant in St. Cloud. So at least that foam isn't going right into the river, which we're right next to. We do a lot of pre-treatment at St. Cloud Hospital. That's a food pulper. Actually, the pulper's upstairs. It's like a big blender, but that's the food extractor. So it takes all of our food waste from the pulper in the kitchen, and then it sorts out the food waste, and we can send that across the river to a compost site. We haven't done pharmaceuticals, sewer wasting for pharmaceuticals for over a year, even though that's the new law coming right up here. We're heavily invested in community solar. We've got about 15 megawatts of community solar contracted for. We don't own it or take credit for the renewable energy, but we did lend our good credit to solar developers to build a bunch more community solar around the region. About 40% of our load for Excel is covered by community solar credits. A lot of what we do, HVAC systems are kind of one of our big energy hogs, so we pay attention to those. Here's some of our, we're trying to squeeze a new chiller into our chiller bay. He's actually cutting the ends off the bolts sticking out of the unistrut there because the chiller wouldn't fit under it. But that's a really fancy freak drive chiller. It saves us energy, and it actually is more reliable because we can start it when we're on generator power. Another thing I manage is underground storage tanks. This is something you never want to see on one of your properties, some guys with buckets underneath one of your old underground storage tanks. I've had to make the call to the duty officer twice in my career at Centricare. Everything turned out fine. We didn't make any too big a mess, but it's still kind of scary with that much fuel oil underground. Another thing we're doing, we're partnering with the Department of Energy and doing advanced lighting at one of our clinics. We're all going LED everywhere, what everyone is, but this is actually, the sensors in the lights will control the building HVAC. So when it goes unoccupied, the building will actually go to its unoccupied mode for air conditioning. And then if you have a lot of fun with lighting, you can find the two colors of light that can make you look like a zombie. So we always try to have a little fun. It's not easy trying to change how people do their business, and especially in healthcare, it gets complicated to start with before folks like us get involved. But we try to have some fun. And you're right, that did go pretty fast. All right, thank you.
Okay, Dana, it's your turn. This is so cool. I just knew everybody was going to have like really different presentations. This is fascinating. I can't wait to see what the questions are that you come up with. Give you that. Yours doesn't start with your picture, so whenever it starts, I think it's going to start, I think.
No, they didn't need my picture, Stephanie. They've got the real thing here. So thank you, everyone, for coming today. I'm Dana Slade. I just had my 8-year anniversary at Health Partners. I am the first and only sustainability leader at Health Partners. Health Partners is an integrated nonprofit health system. We have 8 hospitals, about 80 clinics, and about 27,000 employees now. One of the smartest things we did pretty early on is we made the tie to our mission, vision, and values of the organization. So our 2-person department was transformed from 2 people into 27,000 people. Health Partners and a lot of our competitors are there to support the community. And we have 27,000 people working on sustainability now. So Dustin talked about the intersection of the triple aim and the triple bottom line. We definitely operate there. Our CEO is fully supportive. This is a statement she made. I didn't write it for her at a conference a couple of years ago. We have split our program up into 5 focus areas, and I'll talk a little bit about each of them as we go through this presentation. And one of the things that we wanted to talk about today was the cost savings. Last year, we saved the organization over $3.6 million. We've saved the organization at least 2.1 for 6 years in a row. So in our energy efficiency category, we also have solar. We have 3 sites with solar on site. I was at Westfields today. We are building buildings, really high-performing buildings. Our new beautiful neuroscience center in St. Paul off from Phelan Boulevard has an EUI of 71, and we got $173,000 in rebates for that. Our energy program saved the organization almost $1 million last year. We got $430,000 in rebates, and we got $145,000 in rebates from our solar gardens and our on-site solar. And we've started to invest in sustainable transportation. From a waste perspective, we do lots of waste sorts across Health Partners. We've got an intern now. That's the first question we ask them during our interview. Are you willing to do a waste sort with us? Are you going to dig through the trash? If they say no, they're not our intern. One of the things I'll talk about in a little bit is our medicine take-back program. I'll talk about it right now. We collected over 7,300 pounds of medicine last year. And to put that in perspective, from the public, the previous year we collected 3,700. We have 25 kiosks right now. We're adding 3 more, and we dispose of medicine from the public for free. From our materials perspective, we spend a lot of time reducing paper that we use. We're also a health insurance company, and we don't like to send those big books out to people every year with their medical plans. So we've saved about $750,000 since 2014 on our paper reduction initiatives. We buy locally, and we have 4 leafs that we use in our fleet across the organization right now. And the biggest contributor to our materials savings area is our greening the OR. Last year we saved over $1.9 million in our greening the OR initiatives, and we purchased $2.5 million in food locally, and we are really strong advocates on clean air and water and the health impacts from climate change. From a stewardship and engagement perspective, we have events all the time around the calendar across the organization. We have farmers markets at 4 of our facilities. We do fall events. We have community gardens at our 3 Wisconsin facilities. And this flyer was from our Earth Day event. We do also have a question on our employee engagement survey, and 90% of our employees answered affirmatively. And we partner with a lot of great organizations like Plantables in Hudson. We bought 5,000 of their butterfly bombs 2 years ago to give away around Earth Day. One of the things I'm most proud of is our commitment to climate change. We're the only health system to join the Healthcare Climate Council. We're the only health system in Minnesota to join or to sign We Are Still In. One of our nursing directors helped Practice Green Health design the Nurses Climate Challenge. They are now up over 10,000 nurses across the country that are trained. I talked about our events. One of the big events we have every year is our fall event. This is just pictures from one of our small hospitals in Wisconsin. They are so into it. It's really, really fun. We collected almost over 2 tons of electronics. We gave away 150 pumpkins and gave away 225 barbecued sandwiches. And we seem to go in spurts. We have spring recognition and fall recognition. Last year, this is a list of some of the recognition that we got. So the picture on the lower right-hand corner is our sustainability coordinator and myself, Dr. Mark Seeley. We got the Minnesota Climate Adaptation Partnership Award for an organization. And I talked a little bit about our partnership with organizations. These are all organizations that we work with on a regular basis. And to me, this is why I do this. There's only 2 people doing sustainability at Health Partners, but when we partner with organizations like these, we can have a much bigger impact on the community and really support our mission. And we did pretty darn good with our spring awards this year. We got 29 awards from Practice Green Health, including 5 of our 6 hospitals won the Top 25 award, 17 of our hospitals won Circles of Excellence award, and my former boss won the Visionary Leader award. They give one of those out every year, and it was my boss this year. This is our public sustainability webpage. We have information on our medicine disposal program. We have information on going paperless, so you can get your explanation of benefits and your insurance information paperlessly. And then we brag a little bit about some of the success we've had across the organization. And we really do believe that it's important to be recognized for the things that we do. It really engages our employees. They feel proud about working at Health Partners, and they understand the connection between our mission and what we're doing from a sustainability perspective. So we've done everything, presentations and recognition with all of those organizations. So going forward, we will be setting a carbon reduction or renewable energy goal. I'm almost there. So watch for an announcement on that. We are reducing our plastic bottles, so don't buy those plastic bottles that are out there, and I'll talk more about that if anybody has any questions. Smart anesthesia. Some of the anesthetic gases are horrible. So we're trying, whoop, I'm done. Okay, thank you.
Oh, that was fun. I just want to point out that thank you, Dana, for doing a little fact check on something I said in the intro. It was Becker's 68 greenest hospitals, not Practice Green Health. So thanks. Okay, so now we're going to take a little pause where you can write, and hope you do, write some questions or topics that you're interested in. We've got some helpers that can come around and collect them, or you can just bring them up here and we'll just stick them on the door. So take a few minutes for that. But while we're having the pause, we're going to take a moment for a little, I don't know, commercial break. First of all, thank you to RJM for hosting this event today. I only printed a few of these, and yes, they are on paper because I knew if they were on a slide, they'd be up for 1 second, but you can all look at this. So membership for AMFP is $95. What organization can you join that it's $95 for 4 programs plus some networking events a year? One, AMFP, right? But the reason that we can do that is because we have excellent sponsors. They make it happen for this organization, and these are our sponsors right here. So take a look at who they are. Who is a member of a sponsor organization that's in the audience today? Raise your hand. Yep, awesome. So thank them if you have a minute. And if you're interested in being a sponsor too, because we love sponsors and want as many as possible, I do have some information up front. As well, if you want to join, if you haven't joined yet, a lot of you are members, and I really appreciate that you're committed to this and come all the time. So that's the commercial break. Write your questions now. There'll be silence. Has everybody gotten everything that they want to know? Oh, we got another one. Got another one coming in. Let me see. Okay, so I'm going to review one more time how this is going to work. So we've got, actually it worked out really great because we've kind of got 3 categories of questions that it's like kind of a broad question for each. I think that'll work. So Matt is our timer, and when we ask the question, then we'll let our panelists discuss it for 4 minutes. And at the end of 4 minutes, because he'll like wave his arms, we'll do a thumbs up if we want to continue, or thumbs down if we don't want to continue on that topic, and that's how it'll work. So pretty basic. So I think that we've got microphones. So we're gonna, we have a couple here about LEED. Nobody mentioned LEED. That was one thing that one of you pointed out. So one part of the question is like, how many organizations are doing LEED, or are you pursuing LEED for any of your projects? And tell us more about the best resources you go to for ideas of best practices. Who?
Well, I'll start. I'm holding the microphone. So we, as kind of a, not a technically policy, but we don't pursue LEED in Centricare. We looked into it a couple of times, and once we got the totals for just doing the paperwork and how much that would cost, not only in contractor time, but our own staff time to get it all working, we thought, okay, there's got to be a happy medium here. We'll not do LEED, but we'll try to do kind of LEED inspired. You know, we'll go for certain energy efficiencies. You know, leave the mercury out of everything, do the low VOCs, but don't pay to go through all those hoops. But at the end of the day, we don't have anyone watching the entire projects to make sure that we're doing it to a level that would be LEED similar. And so we chose, well, the simpler approach, I think, but it's not a perfect approach. I will admit that. We let some things slip.
I would agree. I really like that the term LEED inspired. I'd say that's maybe a way that we're approaching our buildings as well. We do have some LEED certified facilities in our system. Northfield, our Northfield Oncology facility is an example of one of our LEED buildings. But I think broadly, for similar reasons, Mayo is not widely pursuing LEED certification on our buildings. And that's where, because of that, that's where the sustainable building policy comes into place, because we want to build sustainable buildings, but how do we do that? So creating sort of that internal mechanism to provide guidance to our facilities groups on how to do that.
I will make it unanimous. We have a similar approach to our construction and renovation process. We did modify the LEED checklist to include some of the things that we're more concerned about, and we are in the process of making that a little bit more on steroids, for lack of a better term, where we provide some targets for our architects and engineers to strive for. We're all about having high-performing buildings without going through the administrative process and burden that LEED seems to bring.
So one thing I'm curious about, because Mayo's got a few LEED facilities, and so does Health Partner Park Nicollet. What made the organization choose to go through the certification process on some projects, but overall not really seek it? Or do you know why those particular projects?
Our Northfield facility, we pursued LEED certification really as an experiment, because it's a smaller facility. We felt like it was a good sized kind of building project to test it out. So that was one of the ways that we could gain a little bit more experience with the LEED certification process. I think our other lead facilities are in Florida, and some of those were either benefactor driven or just site driven opportunities for lead. But the Northfield facility really did give us some really good experience about what it takes to certify a building, and then the cost associated with that as well.
Yeah, I think a similar answer as Amanda. We have one building as part of the Methodist campus. The Frauenschuh Cancer Center is our only LEED certified building. And that went through the process prior to Park Nicollet joining Health Partners. And I believe there was a benefactor issue there too. So.
And that was exactly 4 minutes. Any more time on lead? Thumbs up, thumbs down? Okay, so we'll move on. We've got curiosity about your different programs too. Like to know more about greening the OR successes, what happens to the meds you collect, a little bit more about, I think it's interesting your waste process of treating your water and the whole composting thing, just about your programs in general. And the meds, what happens to the meds that are collected too as well?
So maybe we'll start with greening the OR, because there's a lot there on that one little sheet. Greening the OR is one of, I think, the bigger opportunities for healthcare organizations. A tremendous amount of energy is used in the operating rooms, as well as a lot of waste generation. From the Mayo perspective, I know we aren't nearly as far down the path as Health Partners, but using LED lighting in our ORs. We're also moving in the direction of HVAC setbacks for our operating suites. We're doing that in a handful of ORs on our Rochester campus, as well as some of our other hospital facilities too, but thus far it's not standardized across the system. So we're trying to convince our operating room colleagues, our surgeons and others, that it's okay to do this, that the operating rooms will be ready when they need them, and that it's a great way to save energy in the organization. And then waste segregation is another really big one for the operating rooms. I showed a slide of single-use device reprocessing. It's a way to pull those devices out of the waste stream and reprocess them. They get reprocessed and then resold, reused. So it's a great opportunity. Some recycling happens in the operating rooms as well, especially blue wrap. Blue wrap's a plastic material that's used to cover surgical items before they're sterilized. So it's a clean material that can be recycled. Probably heard of some challenges within the recycling industry though, so I think we're all kind of dealing with that, because a lot of people want to participate in recycling. They immediately think of that as a sustainability opportunity, and we're having to find new ways to do things. I feel like I've monopolized time. Who wants it?
So for us, in addition to the things that Amanda mentioned, the two big areas where we save money in our Greening the OR initiatives are managing our surgical fluids. We have Neptune machines. They kind of look like R2D2, where they collect the surgical fluids. And this is probably not a great topic before we go to happy hour, but they collect the surgical fluids and they're discharged to the sewer through a docking station, as opposed to in the past, they were collected and disposed of as medical waste, which is the second most expensive waste stream that we generate in healthcare. So we manage those better and save money for the organization. I think we saved about $300,000 with our Neptunes that we have in our system. The other savings, big savings that we have is with our buying of single-use devices. The devices that are designed and purchased in healthcare, many of them, most of them, I would say, are designed to be used once and then discarded. There's a whole industry that's grown up around taking those, reprocessing them, and then selling them. And the cost savings is significant. It's about 50% of the original cost of those types of devices. And again, we've saved in the $350,000 a year. And I'll address the medicine disposal issue too, since I have the mic. We collect collect it and it's sent off as hazardous waste, and so it's incinerated. So it keeps it out of people's hands that shouldn't be having it. It also prevents it from being discharged to the environment. What you shouldn't be doing is flushing it, because our wastewater treatment plants don't have the ability to remove those chemicals from the wastewater, and they're being discharged right to our environment. So don't flush them. Take them to Health Partners facilities, or all of your counties also have disposal locations where they will accept them for free.
Thumbs up. Continue this. Okay, let's keep going.
All right. So the fish aren't as happy as they used to be because we're all putting our pharmaceuticals to incineration facilities instead of right down the drain. At our biggest facility, we'll talk about St. Cloud Hospital, greening the OR. Switching to LED lights, it's just the way forward now. It's not even exotic like it was 5 or 6 years ago. But recycling all the packaging in the ORs, they use a lot of material. Moving away from blue wrap, we're doing reusable containers, or like these aluminum clam shells that we use that we can sterilize, and that actually, it works really well. I assume you both use a lot of those. One thing, you talked about the surgery fluids, we'll call them. I was giving a tour of our hospital to the wastewater treatment manager for the city of St. Cloud, and we went right into central processing, and they're cleaning it, and it was the best timing ever. They just stuck one of these canisters full of surgical fluids in there and just vacuumed it out, and she just looks at me and just asked, "Does that go right to the drain?" I was like, "Yeah." Sorry about that. But they expect it. They treat it's a proper use of sanitary disposal. What we did for our pre-treatment in the kitchen, we ran into some phosphorus issues. Our phosphorus levels were too high in that facility because we had tested quarterly on kind of some elements we have to look out for so we don't pollute the wastewater, which then gets converted into fertilizer and then put on the area farm fields. So we have to be really careful about the quality of our water going out of our buildings in the St. Cloud water treatment area. So to try to get was phosphorus. To get the phosphorus out of our waste stream, we went to the kitchen. They had these garbage disposals that they're throwing all kinds of food down, and they're wasting all kinds of water. Actually, the biggest savings from that project was water savings, not energy or anything like that. So we have a system that pulps all of our food waste. It goes downstairs and 150 feet across the building. It gets the solids get filtered out of it. The water gets recycled back up to go through the cycle again and wash new food and food waste down, and it all gets collected in a big hopper as these little pulp pieces. I've tried them in my garden. They're not composted yet, so they'll kill everything if you put too much in your soil. But we just send it to the compost site across the river, and everyone's happy, and our phosphorus levels have reduced greatly, actually, since we implemented that. Anything else on greening the OR?
I had just a question on this, because you mentioned a couple times recycling blue wrap, an issue with that. Can you tell us more about what the issue is with the blue wrap?
Well, I guess the recycling the issue isn't necessarily just with blue wrap, but with recycling markets in general. With China and other countries not taking recycling from the United States, it's put tremendous challenge to the recycling industry. And so the recycling markets, like the money that we used to get or revenue that we used to get, is not quite the same. Some communities have just stopped accepting certain types of recycling as well. So that's what I mean when I say we're having a challenge with finding continued markets for recycled materials.
Now we're going to switch back to construction again. So we had programs, we had lead, and do you have sustainable construction guidelines, and how do you communicate sustainability goals to the design and construction teams? Is it in the contracts, the RFPs, pursuing certification, specifically toward like interiors? What kind of interior finish products do you try to avoid, and which interior finish products do you try to utilize based on product sustainable attributes? And then this is kind of interesting. It's a little bit, takes it to like a scale of a 15,000 square foot or less project. What types, aspects of sustainability would you put into them or could put into them? So it's kind of a lot of questions kind of all mixed together, but they seem to be really related. So.
So I did mention our sustainable building policy. It's very, very new at Mayo Clinic. So it hasn't yet been incorporated into our contracting process. I think that's the next step, is to share that policy as well as the accompanying checklist. The checklist, so the policy keeps things relatively high level, kind of some high level statements about how Mayo wants to approach our new construction and remodel. And then the checklist, though, really dives a little bit deeper into providing some suggestions on ways to sort of put the policy into action. So both the policy and the checklist will eventually be kind of involved in that contracting process. With the question about the sustainable materials, Mayo just recently updated our standards. I think, I'm looking at Ken Potts in the audience, who's also with Mayo Clinic, was instrumental in that project, and so I think that's been communicated to our construction industry partners.
Yes, it has. All master agreement holders.
Perfect, perfect.
Oh, any more you want to say about it? I'm coming with the microphone. Okay, darn.
So for health partners, we started with a checklist. We have been using a revised LEED checklist for 6 or 7 years. And we provide that to all of our contractors, architects and engineers at the beginning of the projects. And I'm not going to say they all use it, but they should all be using it. And we made the decision as an organization that projects over $1 million, we're supposed to always be using it. That has evolved into what we call our construction and renovations considerations list. And it's more of a prioritized hierarchy of the types of projects that we.
That one's not on.
I broke it. And so the priorities list is a prioritized list of the types of things. And with regards to chemicals, we're not prescriptive, but we require that materials don't contain chemicals of concern. So.
And over at CentraCare, we manage our new construction policy just with our energy use policy, which is, again, very high level kind of, you will do this, you won't blow more air than ASHRAE requires, and you won't install excessive amounts of ice machines, just kind of simple stuff like that. And there was a question about the smaller remodels. What can you do on a smaller project that's still sustainable, but it's maybe not all the bells and whistles you're looking for in a new build? Typically, if we're doing a small, 1,500 square foot renovation, we'll just do, switch all the lights over to LED controlled lighting, and all the paints we buy now are low VOC. I don't know, does anybody sell high VOC paint anymore? As far as, there's probably a lot of architects and designers in here. Do you like it when the health systems kind of give you these requirements, or do you want to use your own creativity and use the newest products out there? Is there... What was that? Perfect. So you like direction, but maybe not hard, fast rules. Is that some head nods? Okay. So that's, and with our pre-project planning, hopefully we get some of that done. To anyone who's worked with us, hopefully we did a good job. You can let me know later. And we are at the next question. Unless you want to do, I guess, thumbs up thing.
Thumbs up, thumbs down on this. Down. Well, we're kind of out of questions now that we've had, which is okay and not okay, but we've talked a little more. Has anything come to mind that somebody's curious about? Well, Matt, just hang on for the microphone.
Kind of going back to the construction question, what are you guys seeing that's going to be different with the actual construction? Is it actually going to be physical metal stud walls, sheetrock walls going up on site, or are you going to more of a prefab, look? We kind of hear it both ways sometimes, so I'm just seeing what you guys are thinking kind of going forward. And does that fit into your sustainable goals as you move forward with clinics and expansions on hospitals and everything like that?
I'll start this one off. What we usually do is just take direction from the market and the designers on actual specifying of wall types, kind of the basis like that. We don't, as a sustainability guy, the last thing I want to do is get in the way of a big project. It's like, we're building a brand new hospital. There are so many moving parts. Every time I get involved, I slow everything down. So we try to kind of let the designers take the lead on that, and hopefully they'll take pricing into mind and life cycle.
I don't know that I really have anything to add. I'm not that involved in construction projects to know the specifics of prefab versus, others. Dana, I don't know if you have.
I am the same way, although I have been directed by our leadership to become more involved in some of our construction projects, especially early on. And I think it's paid dividends. One of the things that I really have been impressed with is we're doing a ton of renovations at our Methodist hospital right now, and RJM is our contractor, and they've come forward. And one of the things that I would give them big kudos for is, instead of building the temporary construction walls with drywall and 2x4s, they have reusable construction walls, and those are awesome. I mean, and talk about a sustainable attribute for your projects. You're not having to throw that away at the end of the project, and you can reuse them however many times. So, I mean, that sort of thing is really innovative, and I like it a lot. So I love it when I come across things like that, because now I'm going to tell everybody and his brother about it, both here and within my organization. The other thing related to that is when we were directed to become more involved in the planning process, we brought forward our construction and renovations considerations list, and our CFO, who's brand new, he's been there for less than a year, he said, "You want me to invest all this money up front, but where's the payback? You need to show me how much the payback is going to be for this investment we make up front." And so I'm working with some of our vendors right now to figure that out. And as you can probably imagine, it's not simple. and it's going to depend on the specifics of the project. So we're kind of like eyeballing it right now to see, what you make the investments on. And I mean, the White Group and others like them are doing that all the time with a lot of the infrastructure. The process is out there. We're just starting to learn how we can apply it with our projects.
Matt, did you have a question? Or you just...
How do you make sure that when you solve one problem, you don't create another, so to speak? So when you, for example, get something that's a single use out of the system, and you're moving towards something that is cleanable and reusable, but then you get into how much water is used in the cleaning and process. That basically, how do you track that and measure that effectively? Do you have any examples of something like that where that's happened?
That is a great question, and I think that's a challenge that we all face all the time. We like to look at, and I think I can speak for all three of us on this, that we like to look at the life cycle impacts of anything that we do, whether that's realistic or not on a case-by-case basis is probably not the case. So we try to, make our best guess and go forward with it. And I can give a good example. We switched from styrofoam cups many years ago, and we switched to a cup that the manufacturer said was commercially compostable. Well, it turned out that was a blatant case of greenwashing, and I got some nasty emails from some of our administrators who did Google searches and found out that these products were not compostable, and I felt about this big. So do your research and don't believe what the manufacturers say, is what I have to.
Yeah, when we make a change and it doesn't work out, we're the first to know about it. The staff lets us know. when something with the best of intention turned out a little bit differently than we expected. And so that's a constant thing when it's like it's a form of business process improvement is what we're trying to do, is we try to find a solution, try to get people to try it, and if it works, then we spread it out. If it doesn't work, then it's back to the drawing board, and that's just a daily thing for the sustainability offices for all of us, I believe.
Yeah, I would completely agree. I think honestly, there's no one right answer for really anything. They're just trade-offs. And so you're just choosing, you're trying to choose, what has the least impact, and adjusting a lot. Even I look at some of our energy programs, and we turn down our heating and cooling, especially during unoccupied times. But we ran into an issue with environmental services. We're in the buildings doing cleaning in the evenings, and now all of a sudden getting really hot and humid while working. And so it's just keeping those lines of communication open so that we can figure out those issues early on and then adjust to hopefully fix it.
I'll just add one other thing. I think one thing I've learned is the beauty of doing pilots. Don't just roll things out across the board. Start small, see what issues you run into, and then come up with solutions to them before you roll them out across other parts of the organization. So I think it's really important to understand who your guinea pigs are and who's willing to take the chance on these brilliant ideas that we all have. So.
Yeah, I'll give an example of one time we did a new office building in south side of St. Cloud. It's like not 60,000 square feet. It's not too huge, but it the architect wanted us to use the direct-indirect lights. So it's the LED version of that. So it's just basically a bar of LED down the middle instead of like a flat panel. And I think workers' comp had me on their speed dial for a while, because every time somebody got a migraine in the building, they just called me to fix it. And we ended up just installing dimmers on every light fixture in the building, and it actually worked out well, because now everything's dimmed to about 50%. We're saving a bunch of energy, and everyone's happy again. So, we can work through these problems. It's not the end of the world when we swing and miss. So.
Great. We got a couple more questions in the back. So I think that Rick's hand was up first. Sorry, John Albers, but we'll get back to you.
So far we're talking mostly about the buy-in from the organizations and that kind of thing. How much feedback do you get from patients coming into your facilities? Do you get people saying, ditch the styrofoam cups, or just curious if you get much back from the public or on the websites if people respond to your initiatives? Certainly a lot of them they can't see, but some of the simple consumer items, I'm curious if you hear anything back from the general public that come into your buildings.
So we do, and we do get a lot of feedback from our patients and visitors, and we've requested to see that information too from our patient affairs groups, just to make sure that we're keeping in touch with the feedback that we're receiving. And I think a lot of it is fairly basic, and things that maybe won't surprise you. They're things that patients are encountering on their visit. So when they go into the cafeteria and see that we use a lot of styrofoam, we do get comments about our styrofoam usage. Or if they're walking through the hallway in between appointments and can't find a recycling bin, or there isn't a recycling bin that's convenient, so we hear that. And then another one is on paper. I know, Dana, you talked about your paper reduction initiatives, but we do hear from patients too about receiving a lot of paper from us in the mail, or getting duplicates of things. And so patients do notice, and they let us know, which is great, because then we can take that and try and solve it.
Yeah, we get a lot of feedback from our patients and members too, being an insurance company. So we've gotten comments about our cups. We've gotten comments about plastic bottles. We've gotten a lot of comments about the paper that we use, especially from our insurance side of the building, and also, or the organization, also the after visit summaries that people get after a doctor's appointment. And the other thing that where we get feedback is we have had a table at our annual meeting. Health Partners holds an annual meeting every spring for all of our insurance holders, and we have a table there, and we kind of show off one aspect of our sustainability program every year. But about 50% of the time, we end up talking to people about things they're ticked off about. So it's a good opportunity for us to see, you know, what we can do a little bit better.
We have time for one more question, and John Albers was ready with that one the last time. So here you go, John.
With the initiatives you've been involved with, have you seen any change, increase, decrease in FTEs from any departments? Or, for example, like with LED light fixtures, you're probably having fewer light bulb changers. Are there anything else that you've seen affect FTEs?
I don't know if I've seen changes in FTEs. I have spoken with many new employees who have sought me out and said that they chose to work at Health Partners because of our sustainability program, and that makes you feel pretty good about what we're doing.
I think too, like to your question, you know, specifically about like LED lights and whether or not we still have the same number of folks changing light bulbs. I know the facilities group is awfully busy, and so any FTE gains that they're making, they're just reallocating somewhere else to, you know, to cover other things, which is great. I mean, that's what we should be doing, and those efficiency gains definitely help us focus efforts elsewhere.
Yeah, that's very accurate from facilities point of view. There's always something to do, and especially some of the health systems are running on 1% margins, operating margins, or even less right now. And so everything we can gain, like the LEDs, great. Like I took one building, replaced 15,000 linear lamps with linear LEDs and fixed all the bad ballasts. And it's now the staff doesn't have to change light bulbs now for at least a few years. But they just, plenty of other work took their place. So we don't really see that, but we are providing a higher level of service because of the efficiencies of kind of these more longer lasting technologies. Also with floor scrubbers, we've been doing some experiments with floor scrubbers or like the Orbio machines, and we've actually had to wax a lot less in some of our facilities, which is a lot of time saving, time and money. So it's showing up, but all the resources get immediately allocated. There's no, or reallocated. There's no less work to do, or there's always work to do, we can say.
Well, it's 5:15, so kind of the end of our program time. Let's give a round of applause for our awesome speakers. We truly appreciate you. A couple of you made a really long drive here, and Dana made a mad dash from somewhere, but he got here, so it's great. So just a couple of other things before we go. So one of the things I just want to point out that we're trying something new. We have a videographer here today. So the intent is that we'll get this up on our website so our members can view it again, or view it if they weren't here. And in case you didn't know, that this Upper Midwest chapter, actually our region is not only like Minnesota and the Twin Cities, it's Wisconsin, North Dakota, South Dakota, and Iowa. So we've got a lot of members that we haven't really supported very well, but we're trying to support them for that $95 a year. So that's one of our new things. Also, there is AIA credit for this, or if you want a certificate for some other organization, please just sign the sheet that's up front. We have a couple of upcoming events too. So in September on the 17th, we'll have one of our fun networking, purely networking events, again at Punch Bowl Social. That seems to be a good location in West End in St. Louis Park. And that's a free event, and that's for members and non-members alike, so bring a friend. And then coming up on October 9th at the Midland Country Club, we'll have that Fall Healthcare Summit that we're the educational partners with Corporate Management, squarefootage.com. That's the easiest way to remember it. So that's that like 3/4 day event that we do, been doing the last few years. So again, thank you to RJM for hosting.